I am going to start teaching you about some health because I am doing a project on health and I found it quite helpful and it might be helpful for you too. So here we go. Overall health, a combination of physical, mental, emotional, social, and body health. To get physically healthy, eat nutritious, get exercise, avoid harmful habits, prevent injuries, reach adequate sleep. Mental health, ability to recognize and cope with demands of daily life. Mentally healthy person, free from a mental illness, high self-esteem, likes new things. Emotional health, ability to express feelings in appropriate ways. Emotionally healthy person, copes with feelings without being overwhelmed, knows where support is. Social health, quality of person's relationships. Social healthy person, respects others, seeks, lends support, communicates well. Spiritual health, connectedness with self and others. Spiritual healthy person, lives according to morals, sense of purpose, feels unity with others. In environmental health, keeps surroundings safe and enjoyable. The 6 dimensions are all highly interrelated. Having one affected dimension affects a person's overall health. A person needs wellness in order to have optimal health. This is when a person is at the best throughout all 6 dimensions. Unhealthy behaviors. Adopting harmful habits, getting minimal exercise, avoiding feelings and emotions, lacking self-esteem, having difficulty forming relationships, looking for quick fix solutions. Wellness, healthy behaviors, avoiding harmful habits, exercising regularly, managing emotions well, finding purpose in life, having high self-esteem, eating well, respecting others, making long-term behavior changes, poor overall health, premature death, improved overall health equals wellness. Take personal responsibility. Make good choices. Be willing to make changes. Create balance. Focus on quality of life. Adopt lifestyle. Changes to work towards wellness. Striving for wellness. Important to realize that heredity, environment, and cultural all take a role. Heredity, traits from biologically related parents, the genes. Genes determine hair and eye color and height. Certain genes increase diseases. Common hereditary disease, cancer, heart disease, diabetes, alcoholism, Alzheimer's. To help prevent awareness is key. Get screened. Look for indicators. Self-check. Environment. A person's living and non-living surroundings, family and friends, neighborhood, school, job, physical environment, safety, environmental factors, social environment, peer influence, role models, culture, the shared values, beliefs, and practices of a group. There are 4 different cultural factors: attitude, behavior, media, technology. Culture can positively and negatively influence our health. Attitude is how we react to things. A positive attitude equals positive overall health. Behavior, selecting health foods and others. Media is the various methods of communicating information. This information isn't always accurate. What we are exposed from the media shapes our life. Technology, the application of technical processes and knowledge to meet people's needs and wants. Positive effects equals disease diagnosis, medical treatments. Negative effects are reduced physical activity. Health is dynamic. The closer we are to wellness, the closer we are to living longer. Staying physically active can help prevent or delay certain diseases, including some cancers, heart disease, and diabetes, and also relieves depression and improves our mood. It's important for successful aging to eat foods rich in nutrients and avoid empty calories in candy and sweets. Being obese increases chances of dying from hypertension, type 2 diabetes, coronary heart disease, stroke, gallbladder diseases, osteoarthritis, sleep apnea, respiratory problems, dyslipidemia, endometrial, breast, prostate, and colon cancers. Tobacco is the greatest preventable cause of illness and a premature death. Seniors who self-medicate may use legal and illegal drugs, which can lead to serious health consequences. They can mix medications and use alcohol with medications. Medical people may fail to ask seniors about substance abuse. 11% to 15% of U.S. AIDS occurs in seniors over age 50. Seniors are not represented well in research, clinical drug trials, prevention programs, and intervention. Dementia is caused by disease, reactions to medications, vision and hearing problems, infections, nutritional imbalances, diabetes, and renal failure. The rate of suicide is higher for elderly white men than for any other age group, including adolescents. Falls are the leading cause of injuries. Hospital admissions for trauma and death due to injury. A third of seniors will fall each year. Home security is needed to prevent intrusion. Home-based fire prevention devices should be placed in place and easy to use. 65-plus-year-olds are twice as likely to die in a fire than the general public. Low-income, racial and ethnic minorities are more likely to live in areas where they face environmental risk. Influenza and pneumonia are among the top 10 causes of death for older adults. Lifestyle diseases, diseases caused by a combination of heredity, environment, and unhealthy lifestyle choices. Controllable risk factors. Health risk factors over which individuals have some measure of control. Uncontrollable risk factors. Health risk factors over which individuals do not have control. Public service announcement. Message created to educate people about issues. Advocate. Someone who speaks out or argues in favor of something. Health education, providing accurate health information to people to help them make healthy choices. Risk factor, anything that increases the likelihood of injury, disease, or other health problems. Health literacy, a person's capacity to learn about and understand health information and services. Historically, most deaths in the U.S. were caused by communicable diseases. Diseases today are related to the way people live. Communicable diseases are spread from person to person by direct or indirect contact. Pneumonia, influenza, chickenpox, polio, and tuberculosis no longer threatening because of medical advances, better living conditions, preventive medicines. These diseases are also better understood. Healthy lifestyle choices, getting 8 to 10 hours of sleep each night, eating a healthy breakfast, maintaining a healthy weight, being active for 30 minutes per day, avoiding tobacco, alcohol, and other drugs, managing stress, maintaining positive relationships, and practicing safe behaviors. The majority of people's lifestyle choices will affect their overall health. Some people will become ill or die early, no matter what, while some people will live longer, healthy lives, no matter what. It is impossible to know how lifestyle choices will affect health prevention. Risk factor, anything that increases the likelihood of injury, disease, or other health problems. They fall into two categories: uncontrollable and controllable. Controllable risk factors. Health are risk factors that are controlled by an individual's behavior. The decisions a person makes can expose them to controllable risk factors. Specific behaviors directly linked to serious health problems: sedentary lifestyle, sexual activity, drug and alcohol use, tobacco use, poor diet, injury-causing behaviors. Sedentary lifestyle, not engaging in regular physical activity, linked to obesity, heart disease, and diabetes. Sexual activity can lead to sexually transmitted infections, including HIV and unplanned pregnancies. Drug and alcohol use, major factor in accidents, fights, depression, suicide, and mental disorders. Also linked to the spread of sexually transmitted infections. Don't have control of ourselves. Tobacco use, single leading contributor to premature death in the U.S. Controllable risk factor. Heart disease, cancer, and respiratory disease takes 14 years off our lives. Poor diet can increase chances of developing many diseases. High-fat diets are linked to heart disease, cancer, death. Injury-causing behaviors, behaviors that contribute to the injury of self or others. Examples include carrying a weapon and not wearing a seatbelt, practicing dangerous sports and not wearing supportable gear. Leading causes of death for young people in the U.S. are car accidents, homicide, suicide, other accidents. Historically, most deaths in the U.S. were caused by communicable diseases. Diseases today are related to the way people live. Communicable diseases are spread from person to person by direct or indirect contact. Pneumonia, influenza, chickenpox, polio, and tuberculosis no longer threatening because of medical advances, better living conditions, preventive medicines. Also, they are better understood. Lifestyle diseases caused by a combination of healthy behaviors, heredity, and environment. Heart disease, lung disease, and cancer. Healthy lifestyle choices. Getting 8 to 10 hours of sleep each night. Eating a healthy breakfast. Maintaining a healthy weight. Being active for 30 minutes most days. Avoiding tobacco, alcohol, and other drugs. Managing stress. Maintaining positive relationships. And practicing safe behaviors. It is impossible to know how individual lifestyle choices will affect health. Prevention is the best policy to prevent diseases. Take charge of your health and wellness and the health and wellness of your community. Through knowledge, become health literate, participate in health education, be aware of government programs, advocate for health. Health literacy, person's capacity to learn about and understand health information and services. Use health information and services to promote health and wellness. Critical thinker, develops criteria for health information. Problem solver, knows how to make decisions and health choices. Responsible, promotes health and choices safe, healthy, and legal behaviors. Effective communicator, express the health and knowledge to others. Health education, providing accurate health information to help people make healthy choices. Show the relationship between the healthy living and quality of life. An important factor in preventing the spread of disease and illness is promoting wellness. Found in schools and at community health educations. The U.S. government conducts extensive research and puts together special initiatives to promote health and wellness. Every 10 years, the U.S. Department of Health and Human Services releases national health goals, objectives, and actions plans in order to encourage organizations to implement healthier practices. Health of People 2020 assesses major risks to health and wellness, changing health priorities, emerging issues related to national health. Goals are to increase the quality and year of healthy life and eliminate health disparities. Physical activity guidelines for Americans describes the types and amounts of physical activity that offer health benefits to Americans. Dietary guidelines for Americans provides information on how dietary habits promote health and reduce the risk for major chronic diseases. Health and wellness advocate lead by example, volunteer your time, create public service announcements, PSA, message created to educate people about an issue, combines in many different formats, radio, television, poster, or essay, which is important to you. Health risk factors over which individuals do not have control, controllable risk factors, age, hereditary, gender, health history, tobacco use, single leading contributor to premature death in the U.S., controllable risk factor, heart disease, cancer, and respiratory disease, takes 14 years off our lives. Short-term goal. Goals that take days, weeks, or months to achieve help achieve long-term goals. Long-term goals. Goals that take over 6 months to several years to accomplish. Decision-making skills. The learned ability to formulate and follow through with a particular decision. Collaborate. To work together with one or more people. Routine decisions. Decisions made on a daily basis require little or no thought. Brush teeth, eat breakfast. Impulse decisions, very quick decisions, require little thought or planning. Go out of town for weekend. Big decisions can be life-changing, require a lot of thought. Getting married, having children, changing school, where to work. Don't confuse impulse and big decisions. Many factors influence the decisions a person makes. Internal influences, external influences. Influences can promote or inhibit decision making. Internal factors: attitude, emotions, values, goals, priorities, ethics. Emotions: upset, excited, angry, happy, control them, or they have control over us. Too emotional: ending relationship. Values, goals, and priorities. Keep in mind, don't do things they tell you not to. Say no. Don't spread a rumor. Align with ethics. Think of decisions. External factors: families, peers, media, society, culture, economic factors. Family: food, healthy or eat unhealthy. Peers: peer pressure, positive, negative, may compromise health. Media: TV, radio, movies, absorbed by you, how you talk and behavior, clothes you wear. Society and culture, religion, current events, being curious. Economic factors: buy a car, would it be a new car or an old car? Consequences can affect individual or others. Be immediate or long-lasting. Be positive, negative, or a combination of both. Decision: earn higher grades. The consequences are less of free time. Parents are happier, accepted to an honors program. The benefits are longer curfew. Make decisions every day. Many factors influence your decisions, impact yourself and others. Having and using a decision-making process makes it easier. One approach to making a decision is to be strong. Strong. S. State. T. Think. R. Rate. O. Organize. N. Narrow. G. Go. S. State the issue. What decision needs to be made? Offer scholarship. Move out of town. T. Think about and list your options. What choices could you possibly make? What is the most important? What are possible alternative outcomes? Go out with friends. Do homework. Family. Friends. Don't make mistakes to learn from it. People may face similar situations. What consequences would relatives have similar experiences? R. Rate the consequences for each option. Use the word help to direct you. H. Healthy. Are there any health risks? E. Ethical. Do you believe this action is okay? L. Legal. Does it violate any laws? P. Parents. Would your parents approve? O. Organize. Organize your thoughts. Decision should reflect values. N. Narrow down the possibilities to one and act on it. Choose the best possible option for you and anyone else involved. G. Go over your decision. Did you get the intended outcome? Were there unintended consequences? Do you need to make changes? Decisions can be easier to make with someone else. Seek advice. Collaborate with family, friends, someone you trust. Offered another job, more money, moving place? Why are poor decisions made? Decision was made impulsively. Impact on others are overlooked. Decision-making process wasn't followed. Emotions unbalanced, friend and family overlooked. Consequences of poor decision: embarrassment, humiliation, danger for self and others. To correct a poor decision, use the stop, think, and go plan. Stop and admit that a poor decision was made. Take responsibility for actions. Don't blame others. Realize something better could have been done. Don't lie. Think about whom you can talk to. Parents, teachers, school counselor, friends. Tell what the decision was and what the consequences have been. Discuss options to correct the situation. Steal something, see best approach. Be honest. Go and do your best to correct the problem. Leave the situation if necessary. Tell about an unsafe situation. Apologize if you hurt someone. Learn from your mistake. Don't fight. Don't get in trouble. Call authorities. Admitting to a poor decision is difficult. Trouble with parents, teachers, or law enforcement. Angry friends. Feel better in the long run. Adhered to values. Did what was right. Prevented something from turning even worse. Goals: a future desired achievement or objective a person plans to accomplish. Task: activities which must be completed in order to accomplish goals. Objective measure: a method of assessing whether a condition or goal has been met, which is free from bias, wishful thinking, or opinion. Objective acknowledgment: a method of tracking whether action necessary to completing a goal has been accomplished. Subjective rating: a method for tracking goals that are based on feelings, emotions, or other hard-to-measure metrics. Accountability: a system for ensuring tasks and goals are completed. Mentor: an experienced individual who can help, encourage, and motivate a more inexperienced person to achieve their goals. Action plan: a list of steps which individuals achieve their goals by, describing the task necessary to the completion of the goal. What are goals? Objectives to work towards, desired achievements: get a part-time job, increase my bench press, make new friends, practice the guitar daily for 30 minutes. All goals require tasks, things that need to be done to achieve goals, required activities to complete goals. Goal: pass the next algebra test with at least a B+. Ask teacher for help. Go to tutoring sessions. Complete every homework problem. Find a study partner. Review notes nightly. A person can have multiple goals at once. Goals can relate to any life aspect. Managing those goals requires the ability to prioritize them. How to prioritize goals: outline desired goals. Decide which is most important. Organize into categories. Example prioritization: personal goals, financial goals, academic goals. Example: short-term goal: lose 5 pounds a month. Long-term goal is to lose 40 pounds. Setting goals: prioritize short-term, long-term. Define goals. Quantify goals. Set up a specific timeline. Set realistic goals. Create accountability. Positive and effective purpose. What is the desired achievement? Be specific and focused. Desired achievement. Improve appearance. Goal 1. Lose weight. Goal 2. Improve physical fitness. Ensure goals are measurable. Measurable progress determines success. 3 ways to measure progress. Objective measure, weight on scale. Objective acknowledgment, logging daily diet. Subjective rating, rating of daily mood. Create specific timeframes for each goal. Goal 1, Goal 2, Goal 3, Goal 4, Goal 5. Strive for reasonable goals and timeframes. Try mini goals with short deadlines. Example, train to run a 5K in 3 weeks. Set up a calendar. Accountability. Creating a method of making sure things are done. Choose a mentor. Use motivation to achieve goals. Purpose. Map out the milestones and goals. Identify how to achieve milestones and goals. Clarify the goal. Visualize the outcome. How can the goal be measured? What are the constraints? Write a list of actions. Brainstorm options and ideas necessities to achieve the goal. Organize. Rearrange action items. Sequence items into ordered times. Monitor and review. Adjust plan as necessary. Action item. Run 3 miles 4 times a week. Squat 30 more pounds. Improve science grade. Improve science grade. Week 1 equals talk to your teacher, join study group, do homework nightly. Week 2, talk to the teacher, join study group, do homework nightly. Week 3, talk to the teacher, join study group, review notes, do homework nightly. Sebaceous gland, a gland which secretes oily sebum which lubricates the hair and skin. Ultraviolet radiation, invisible form of light produced by the sun which can cause tanning, sunburn, and cancer. Direct exposure to ultraviolet A and B rays can be harmful. Indirect exposure can be harmful through windows on cloudy days while driving. Some factors that increase the risk of damage from exposure to UV rays include medication, genetics, lifestyle, location. Consequences of too much exposure: sunburn, premature skin aging, skin cancer. Skin cancer, basal cell carcinoma, squamous cell carcinoma, melanoma. How can you stay sun safe? Take cover, wear sunscreen, use skin lotions, limit exposure time. Take cover, wear a wide-brimmed hat, seek shade when possible, wear clothes that cover areas that are prone to damage, sunglasses with UV protection. Wear sunscreen. Use SPF 15 or higher. Cover all exposed areas. Apply 20 minutes before going outside. Reapply every 2 to 3 hours. Use skin lotions. Use skin lotions with vitamin C and E. Protects against indirect exposure. Helps damaged skin cells to repair themselves faster. Avoid damage from UV rays. Be aware of sun's rays. Cover up. Wear sunscreen. Use lotions. Be aware of risk factors. Insufficient sleep can negatively affect the immune system, performance in school, performance in sports and other activities, mood disposition, and relationships tiredness. Sleep is affected by personal habits throughout the day, sleep environment, bedtime routine. Good sleep hygiene. Go to sleep at the same time every day. Wake up at the same time every day. Exercising regularly. Poor sleep hygiene. Long naps during the day. Consuming alcohol, caffeine, spicy foods, and sugary foods. Sleep environment. Use comfortable bedding. Maintain a comfortable temperature. Keep room well ventilated. Block out distracting noise and light. Reserve bed for sleep. Sleep-inducing foods are warm milk and bananas. Relaxation techniques, yoga, deep breathing. Don't take your worries to bed. Clear your mind. And yoga would be something that would be helpful for that. Use pre-sleep rituals, warm bath, reading, 15 to 30 minutes time limit. Get up, get sleepy. Avoid electronics, no television and no computers in the bed. Social physic anxiety, a mental condition describing someone whose thoughts are constantly worrying about what others think of their physical appearance, which is not good. Self-presentation, the extent to which one demonstrates their qualification, initiative, and likelihood to succeed. Binge drinking, consuming dangerously large amounts of alcohol in one session. Pharmacist, a person licensed to prepare and dispense medications. Factors to consider: credibility, risk, cost. Credibility, scientific studies or research, safety, effectiveness, side effects, treatment methods, health care provider, answer questions, can discuss costs and benefits of any given treatment option. Individual treatment plan. Credibility, manufacturer. Reputation, recalls, clinical trials, professional opinions, pharmacists, doctors, company ethics, strict guidelines, quality control conditions, natural remedies, not always effective, result not scientifically tested, not necessarily safe. FDA does not test. Be aware of buzzwords. Miracle cure. Treats many illnesses. Completely natural. No side effects. Holistic. Studies are underway. Be careful. Get second opinions. Talk to others who took a treatment. Make level-headed decisions. Use common sense. Risk. Potential side effects cure worse than a disease. Many ingredients increase potential for harmful side effects. Emergency procedure needed for continued survival. Standard of living. Cancer treatments, schizophrenia meds, prescription medications, over-the-counter medications, allergies, elective procedure, planned non-emergency procedure may be necessary. Cataract surgery, rhinoplasty, nose job. Cost. Brand expense. Name brand products are generally more expensive than generic. Price can occasionally be a predictor of quality. Health insurance services. Covered products that covered. Deductible expenses. Out-of-pocket costs. Recovery. Media. Methods for communicating information. An average adult sees 600 advertisements a day and watches 28 hours of television per week. Advertisement, a written or spoken message designed to interest customers in purchasing a product or service, affect consumer attitudes towards a product, influence the consumer's lifestyle. Hidden messages, everyone is using it, you should too. It will make you feel rich and famous. It's too good a deal to pass. This product will make your life more fun. It worked for them, so it will work for you. It's a natural, so it must be healthy. Fast food ads, physical activity, campaigns, alcohol and tobacco advertisements, well-known, often appear in fast food ads. Make a fast food seem healthier. Misleading message. Fast food is eaten often. Fast food is an attractive lifestyle choice. You can eat fast food and be healthy. Fast food should only be eaten occasionally. Fast food typically has high levels of salt, sugar, fat. Consumption can contribute to obesity, diabetes, and more. Physical activity campaigns is an ad campaign to get people to act healthier. Would it be more effective to focus on health or an appearance? Health as a motivator. Positive effects on social, physic, anxiety, self-presentation. appearance as motivator, negative effects on non-exerciser attitudes towards exercise. Alcohol advertising contributes being a factor in underage drinking. 28% of high school seniors report binge drinking. Increased risk with alcohol use, unprotected sex, sexually transmitted disease. Tobacco advertising influence on children. 4,000 kids try their first cigarette every day. 1,000 begin to smoke regularly. 1/3 of regular smokers die prematurely. Analyzing media messages. What are they trying to say? What are they trying to sell? How does this message influence me? What am I going to do? Health in the media. Athletes, physical activity, alcohol, tobacco. Technology allows for faster communication, makes it easier to share information, creates more sources of information. Faster communication. Many devices allow for near instantaneous communication. Cell phones, smartphones, email, VoIP, teleconferencing allows instant access anywhere to any information, reduces isolation, increases collaboration, innovation can spread quickly, faster transportation, and advances in logistics makes the world smaller. Easier sharing. The growth in the internet allows for wide dissemination of information. Blogs, Facebook, Twitter, medical information is available to anyone who can find it. Non-experts are able to read professional medical information, and sources may rely on others to read and interpret. People can decide for themselves what to believe, but they will not always decide wisely. More sources. As a result of the ease of sharing, many more sources are available. Reputable sources, medical professionals, medical websites, consumer advocacy groups. Disreputable sources, rumor monitors, quack medicine sites, simple misinformation, misinformed sources, sloppy sources. More sources. Many people assume an expertise they do not have. People repeat ideas that make sense to them, regardless of evidence. Everyone's voice is equally loud. Establishing credibility. Gathering information quickly is easy. Gathering credible information is hard. How do we figure out who to listen to? Why was the website created? Who developed the website? Is there bias or conflict? Who is the site's intended audience? Who is responsible for the information? Other authors' qualifications, contact information, qualify assurance process. Online source credibility, diseases and conditions, treatment options, up-to-date good coverage of topics, alternatives for obtaining information, help available, contact email customer support links from other reputable sites. Information is presented professionally, balanced, unbiased information, references cited. Online credibility, author credentials, resources, professional. Health risk appraisal, an assessment tool used to evaluate an individual's health. Environmental tobacco smoke, air that has been contaminated by tobacco smoke. Healthy lifestyle, lifestyle strategies meant to prevent heart disease. Health and wellness coach, a health professional who collaborates with clients about fitness, nutrition, and weight management. Lifestyle and a weight management consultant, a health and a fitness professional who develops weight management programs for clients. Group fitness instructor, a health and a fitness professional who teaches a variety of fitness classes. Personal trainer, a health and fitness professional who works individually with clients to develop customized exercise plans. Dietitian, a health professional who manages food service systems by planning good and nutrition programs. Chronic disease, a long-lasting or recurrent disease. Community health centers, facilities that provide primary health care to medically underserved populations. Healthcare, the way in which people are able to receive and pay for medical care. Providers, facilities, treatment options, techniques, medicines. Primary care physician, medical doctor, doctor of osteopathy, physician's assistant, nurse practitioner, specialist nurses. PCP, providing the first point of contact for patients, responsible for diagnosis, treatment, health promotion, disease prevention, health maintenance, counseling, patient education, medical doctor, MD, general practitioners, treat patients' symptoms, focus on diagnosis and treatment, doctor of osteopathy, do concerned with wellness, treat a whole person, focus on preventive care. Nurse practitioners, operate independently, able to diagnose and treat patients. Monitor health and maintenance, counseling, disease prevention. Physician's assistants can make medical decisions independently, able to diagnose and treat patients. Health maintenance, counseling, disease prevention can make medical decisions independently, regularly supervised and consulted by practicing physician. Diagnosis, treatment, prevention. Specialists focus on one field. Bones cancer surgery generally seen after consultation with PCP. Nurses provide ongoing care treatment of patients, maintain health, recovery from conditions, disease prevention, cannot diagnose a patient, cannot prescribe medicine. Practices, private practice, group practice, general treatment centers, hospital community clinic, emergency treatment, emergency room, urgent care. Private practice, outpatient, one person there. Group practice, more than one doctor, share office space. Hospital, costed more than community clinic. Offer more service. Hire knowledgeable staff. Community clinic, cost effective. Emergency room, a hospital, lots of beds. Life-threatening. Urgent care, non-life-threatening, typically community health promotion efforts, long-term health improvements, senior citizen health promotion, preventive initiative for children, disease prevention programs, long-term health improvements, assist individuals in reaching their health behavior goals. Self-help pamphlets, counseling, health risk appraisals affecting the community, establishing new community norms, education and community organization. Senior citizen health promotion encourages health and active lifestyles. Social activities, continuing education, health and wellness, volunteering, exercise programs, preventive initiative for children, after school and in-school programs, tutoring, mentoring, parent education designed to prevent self-destructive behaviors, alcohol, drug abuse, violence, teen pregnancy, disease prevention programs, tobacco control, preventing and reducing diseases, disability death, community protection, environmental tobacco smoke, waiting assistance programs, preventive from beginning use. Disease prevention programs, cardiovascular health improvements through change in policy, environment targeted promotion of heart health lifestyles. What do they offer? Identify your issue. Target the correct professional. How can you choose? Establish criteria for choosing a professional. Types of medical professionals. Primary care, specialists, industrial specialists. Primary care professionals. first point of contact, offer many services. Medical specialists receive focused training and experience in one area, usually referred by primary care professional. Medical specialists, allergies, anesthesiologists, pain management, cardiologists, cancer gynecologists, female reproductive system, neurologists, brain orthodontist, teeth and jaw alignment, pediatrician, children's health, psychiatrist, mental health, surgeon operates on patients. Industry professionals, personal trainers, dietitians, health and wellness coaches. Personal trainers work individually with clients, develop customized exercise plans, help achieve fitness goals, ensure proper safe exercise. What do they offer? Identify your issue, target the correct professional. How can you choose? Establish criteria for choosing a professional. You need to be comfortable sharing your medical history, discussing private health matters, receiving advice and counsel from them. Percent of cost. Hospital care equals 30%, 31%. Physician clinical services equals 21%. Others equals 14%. Prescription drugs equals 10%. Investment equals 7%. Program administration equals 7%. Nursing home equals 6%. And dental equals 4%. Technology and prescription drugs. Consumer demand more intense and costly services. Chronic disease, longer lifespans, aging population, high administrative costs, type of medical insurance, health and maintenance organizations, preferred provider organizations, point of service plans, health and savings account, out of pocket. Health and maintenance organization, no co-payment, low premiums, no deductible, select primary care physician, PCP referrals usually required, limited selection of network doctors, typically no coverage provided for out-of-network services, preferred provider organizations, PPO, co-payment to high premiums, yearly deductible, do not require primary care physician. No referrals required. Emphasis on in-network care. Coverage for out-of-network services. More expensive. Point of services. POS. Co-payment. Higher premium. Require primary care physician. PCP referrals. Usually required. Emphasis on in-network care. Coverage for out-of-network services. More expensive. Health savings account, HSA. Save money in tax-free account. Deduct medical expenses from account. Out-of-pocket, OOP. Pay full cost for services. No restrictions on a service except cost. Many do not have access to quality health care. Barriers to accessible health care. Individuals uninsured or uninsured lack of health access. Difficulties coordinating a service, primary care, hospital, clinics, individuals with limited understanding. Community health care can provide safety net. Primary care provides urgent care, expands available health care services, promotes health education, disease prevention, focuses on wellness. Payment and funding. Accept many types of insurance. Receive government funds. Local, state, federal, partner with nonprofits. Offer financial assistance. Check with local clinics to determine their service offered. Payment methods and specific programs. Fallacy. False or mistaken idea. Often based on illogical or invalid reasoning and facts. Food and Drug Administration, FDA. Federal government agency in the United States which enforces laws and regulations regarding the manufacturing, testing, and use of Food, Drugs, and Medical Devices, Office of Inspector General, OIG, federal agency which protects the integrity of the Department of Health and Human Services programs, as well as the health and the welfare of the beneficiaries of these programs. Common health policies. Low-carb diets are healthy. Nutritional supplements guarantee optimal nutrition. Low-calorie menus are healthy and nutritionally sound. Heart disease only affects men. Weight training makes women look unnatural. Sit-ups can make you thin. Stay in the fat-burning zone while exercising. Low-carb diets can be dangerous. The body needs carbohydrates, feeds the brain, metabolizes fats that protects protein and diet risk. Kidney function failure, water loss and dehydration, heart danger, high salt and fat intake. Nutritional supplements can't cover all nutritional needs. Excessive intake of supplements can be harmful. Optimal nutrition does not come from one food, one single nutrition, one combination of foods. Optimal nutrition results from eating a variety of nutritions from a wide variety of foods. Low-calorie menus depend on preparation, portions, garnish. Food can have higher calorie count than advertised dependent on who prepares foods. How carefully guidelines are followed. Restaurant salads are not necessarily healthy either. Can be higher in calories and fat. Dressing in fat, body can be deprived of major food groups. Heart disease does affect men and women about equally. 870,000 annual deaths from heart disease. 450,000 are females. If women show different symptoms, often dismissed as stress-related, fatigue, lethargy, insomnia. 64% of female deaths from heart disease shows no previous symptoms. Weight training will not bulk most people unnaturally. Weightlifters use many supplements to bulk up. Normally, women do not have the hormone balance to bulk up. Weight training has many benefits. Muscle is metabolically active, burns calories more effectively, helps to achieve long-term fitness goals. Fat reduction is a myth. Abdominal exercises will not reduce belly fat. Increase muscle strength. Muscle mass changes, and not fat. How to get rid of fat equals cardiovascular exercise, vigorous and long duration, running or spinning. Healthy exercise will be constantly challenging. Calories are burned either way. Calorie source, fat, carbohydrates. Doesn't matter. Vigorous, challenging exercises achieves the best health benefits. Cardiorespiratory benefits, body consumption benefits. United States government's principal agency for protecting the health of all Americans and providing essential human services. U.S. Department of Health and Human Services, Food and Drug Administration, and Office of Inspector General. Drugs and complex and medical devices must be proven safe and effective. Food additives must not cause serious harm. Existing types of equipment must meet performance standards. Cosmetics and dietary supplements, FDA approval not needed to market subject to safety regulations. FDA approval process can be as fast as 6 months for innovative drugs, can take years for other drugs. FDA evaluates whether the benefits outweigh the risk. No product is totally risk-free. If a product does not have FDA approval, it might still be in review. It might be ineffective. It might be illegal. Center for Drug Evaluation in research, drug review and approval, product monitoring. Thank you, and have a nice day.